Hello students, another clinical scenario based question in respiratory medicine. So this is the new pattern questions that they're going to ask you in the upcoming exams. Given history, patient is having pneumonia and he is presenting with a chest x-ray. So they have given you the clinical scenario called pneumonia and his chest x-ray. So they're asking you what will be the history of the patient. So in the new pattern, it will be logical reasoning, analysis, and it will make you search for answer with the given clinical scenario. Now they haven't asked you regarding the treatment, they haven't asked you regarding the chest x-ray feature. So they are asking you to correlate with the given chest x-ray and the probable history. Now first let us see the chest x-ray and what information that we can get here. So this is the right side and this is the left side. Now if you notice, left lung is good, properly expanded, and the lung parenchyma is showing no abnormality, whereas in the right lung you can see some abnormality in this area. So this is the abnormal area. You can consider this is the abnormal area. But if you keenly notice, what is the abnormality that you identify? So if you see, there is a well-defined round area filled with air looking like a cavity. So in that cavity, you can also see a fluid level. So cavity with the fluid level, it is called as lung abscess. So here you can see right upper zone lung abscess. So there is a right upper zone lung abscess. So it is not yet over. Along with a lung abscess, so there are so many organisms causing lung abscess. There is a classical finding in this chest x-ray. Normally your horizontal fissure will be straight like this, but what has happened to the horizontal fissure due to this infection, it has bulged down like this. Normally horizontal fissure will be straight like this. So whenever there is some heavy consolidation or anything that causes some abnormality in the right upper zone, significant involvement, so because of that weight, your horizontal fissure, instead of being straight, it can bulge down. It will become like this. So this phenomena is called as bulging fissure sign. Bulging fissure sign. So there is lung abscess. Along with that, there is a bulging fissure sign. So what is the organism that is known to cause lung abscess with the characteristic bulging fissure sign? So the answer is Klebsiella. So you find this in Klebsiella pneumoniae. So in Klebsiella pneumonia, you find this. Now, what are the risk factors for Klebsiella pneumonia? Risk factor is alcoholism. And what is the characteristic clinical finding? There will be thick, gelatinous, reddish sputum. So sputum will be very, very thick and it will be a gel-like. Because of the Klebsiella covering, the sputum will appear gel-like. It is called as red currant jelly sputum. Sputum in Klebsiella pneumonia will be gelatinous and thick. So this phenomena is called as red currant jelly sputum. Now what is the information that I have derived? So this patient in the given question, he is having lung abscess, bulging fissure sign. Out of these four options, in whom it can happen? In a patient who is alcoholic and who is expectorating red currant jelly sputum. So the answer is option B. Now, Why it is not option A, option C, option D also you should know. So this is an extra edge, so that if at all they give you a different scenario, now you should make out the other options also. Now let us see with the help of a table. If at all they give you in a question, patient is having history of some ship travel, predominantly dry cough. So predominantly dry cough is a feature of atypical pneumonia. Predominantly dry cough is a feature of atypical pneumonia. So ship travel, what is going to happen? There will be exposure to contaminated water. And what is the organism that is spread through contaminated water and can cause atypical pneumonia? Answer here will be Legionella. So if you find a clinical scenario telling you that the patient is undergoing a ship travel or he has history of ship travel, later on he presented with atypical pneumonia, probable organism is Legionella. Alcoholism plus red currant jelly sputum, already I have discussed, the organism will be Klebsiella. Preceding H1N1 infection. So this patient might have recently recovered from H1N1. So what is H1N1? Influenza, swine flu. So he has recovered from swine flu, or he is having history of H1N1 infection with the mucoid sputum. So most probably the answer here will be bacterial pneumonia. So what are the bacteria that can cause pneumonia after H1N1 infection? So it can be seen in Streptococcus pneumoniae and also Staph aureus. So Streptococcus can cause pneumonia in this patient. Staph can also cause pneumonia. But out of this, if they ask you which can lead to mortality, so Staph pneumonia can be severe in this patient and it can also lead to mortality. So they will ask you a question like this. This patient recently recovered from viral illness. After a few weeks, he developed a bacterial pneumonia that resulted in death. Then your answer should be Staph pneumonia. Now, history of cystic fibrosis and green sputum. So whenever they mention presence of bronchiectasis, structural lung disease, all nearly mean the same. So structural lung disease, or patient is having pre-existing bronchiectasis. Now he developed a lung infection. Most common in these patients will be Pseudomonas. And you know that in Pseudomonas infection, there can be a greenish sputum. So these are the keywords that you should see in the exam and identify the organism. Ship travel as discussed earlier with the dry cough, Legionella. If the keyword is alcoholism with red currant jelly sputum, it is Klebsiella. So if at all they mention patient is alcoholic and he has foul smelling sputum. So foul smelling sputum. So then your answer organism should be anaerobes. So there can be lung abscess due to anaerobes. So alcoholism, foul smelling sputum. In chest X-ray you can also find lung abscess. So probably anaerobes. So here alcoholism is associated with red currant jelly sputum. So that's why answer here is Klebsiella. Alcoholism with foul smelling sputum, the organism can be anaerobes. Alcoholism with foul smelling sputum, anaerobes. Alcoholism with red currant jelly sputum, organism is Klebsiella. Then H1N1 infection, mucoid sputum, mostly the patient must have developed bacterial pneumonia. Common ones are Streptococcus, Staph. Out of this, which causes mortality? Usually it is staph has tendency to cause mortality because of its severe presentation. Then history of structural lung disease such as cystic fibrosis and patient presenting with green sputum, it is Pseudomonas. So these are all the new pattern of questions available in the eMedicoz app and in DAMS question bank. So once you go through such new pattern of questions, you do them regularly, you apply your knowledge, it will become very easy for you to answer in the real exam. Thank you.